Safe drinking water, sanitation, and hygiene are crucial to human health and well-being. Safe wash is not only a prerequisite to health, but contributes to livelihoods, school attendance, and dignity, and helps to create resilient communities living in healthy environments. Drinking unsafe water impairs health through illnesses such as diarrhea, and untreated excreta contaminates groundwaters and surface waters used for drinking water, irrigation, bathing, and household purposes. Chemical contamination of water continues to pose a health burden, whether natural in origin such as arsenic and fluoride, or anthropogenic such as nitrate. Safe and sufficient wash plays a key role in preventing numerous NTDs such as trachoma, soil-transmitted helminths, and schistosomiasis. Diarrheal deaths as a result of inadequate wash were reduced by half during the Millennium Development Goal, MDG, period, 1990 to 2015, with the significant progress on water and sanitation provision playing a key role. Evidence suggests that improving service levels towards safely managed drinking water or sanitation such as regulated piped water or connections to sewers with wastewater treatment can dramatically improve health by reducing diarrheal disease deaths. WASH is a sector in development cooperation or within local governments that provides water, sanitation, and hygiene services to people. The main purposes of providing access to WASH services include achieving public health gains, implementing the human right to water and sanitation, reducing the burden of collecting drinking water for women, and improving education and health outcomes at schools and health facilities. Access to WASH services is also an important component of water security. Universal, affordable, and sustainable access to WASH is a key issue within international development and is the focus of the first two targets of Sustainable Development Goal 6, SDG 6. Targets 6.1 and 6.2 aim for equitable and accessible water and sanitation for all. In 2017, it was estimated that 2.3 billion people live without basic sanitation facilities, and 844 million people live without access to safe and clean drinking water. The acronym WASH is used widely by non-governmental organizations and aid agencies in developing countries. The WASH attributable burden of disease and injuries has been studied in depth. Typical diseases and conditions associated with a lack of WASH include diarrhea, malnutrition, and stunting, in addition to neglected tropical diseases. Lack of WASH poses additional health risks for women, for example, during pregnancy or in connection with menstrual hygiene management. Chronic diarrhea can have long-term negative effects on children in terms of both physical and cognitive development. Still, collecting precise scientific evidence regarding health outcomes that result from improved access to WASH is difficult due to a range of complicating factors. Scholars suggest a need for longer-term studies of technology efficacy, greater analysis of sanitation interventions, and studies of the combined effects of multiple interventions to better analyze WASH health outcomes. Access to WASH needs to be provided at the household level but also in non-household settings like schools, healthcare facilities, workplaces, including prisons, temporary use settings, and for dislocated populations. In schools, group hand-washing facilities can improve hygiene. Lack of WASH facilities at schools often prevents female students from attending school, thus reducing their educational achievements. It is difficult to provide safely managed WASH services in urban slums. WASH systems can also fail quite soon after installation, example leaking water distribution systems. Further challenges include polluted water sources and the impacts of climate change on water security. Planning approaches for more reliable and equitable access to WASH include, for example, national WASH plans and monitoring, women's empowerment, and improving the climate resilience of WASH services. Adaptive capacity in water management systems can help to absorb some of the impacts of climate-related events and increase climate resilience. Stakeholders at various scales, i.e., from small urban utilities to national governments, need to have access to reliable information about the regional climate and any expected changes due to climate change. Components. The concept of WASH groups together water supply, Access to drinking water services, sanitation, and hygiene. Because the impact of deficiencies in each area overlaps strongly, WASH is an acronym that uses the first letters of water, sanitation, and hygiene. WASH consists of access to drinking water services, sanitation services, and hygiene. A safely managed drinking water service is one located on premises, available when needed and free from contamination. The terms improved water source and unimproved water source were coined in 2002 as a drinking water monitoring tool by the JMP of UNICEF and WHO. The term improved water source refers to piped water on premises, piped household water connection located inside the user's dwelling, plot, or yard, and other improved drinking water sources, public taps or standpipes, tube wells or boreholes, protected dug wells, protected springs, and rainwater collection. Access to drinking water is included in Target 6.1 of Sustainable Development Goal 6, SDG 6, which states, by 2030, achieve universal and equitable access to safe and affordable drinking water for all. This target has one indicator. Indicator 6.1.1 is the proportion of population using safely managed drinking water services. In 2017, 844 million people still lacked even a basic drinking water service. In 2019 it was reported that 435 million people used unimproved sources for their drinking water, and 144 million still used surface waters, such as lakes and streams. Drinking water can be sourced from the following water sources: surface water, groundwater, or rainwater, in each case after collection, treatment, and distribution. Desalinated seawater is another potential source for drinking water. People without access to safe, reliable domestic water supplies face lower water security at specific times throughout the year due to cyclical changes in water quantity or quality. For example, where access to water on premises is not available, drinking water quality at the point of use, PO, can be much worse compared to the quality at the point of collection, POC. Correct household practices around hygiene, storage, and treatment are therefore important. There are interactions between weather, water source, and management, and these in turn impact drinking water safety. Groundwater provides critical fresh water supply, particularly in dry regions where surface water availability is limited. Globally, more than one-third of the water used originates from underground. In the mid-latitude arid and semi-arid regions lacking sufficient surface water supply from rivers and reservoirs, groundwater is critical for sustaining global ecology and meeting societal needs of drinking water and food production. The demand for groundwater is rapidly increasing with population growth, while climate change is imposing additional stress on water resources and raising the probability of severe drought occurrence. The anthropogenic effects on groundwater resources are mainly due to groundwater pumping and the indirect effects of irrigation and land use changes. Groundwater plays a central role in sustaining water supplies and livelihoods in sub-Saharan Africa. In some cases, groundwater is an additional water source that was not used previously. Reliance on groundwater is increasing in sub-Saharan Africa as development programs work towards improving water access and strengthening resilience to climate change. 19 In lower income areas, groundwater supplies are typically installed without water quality treatment infrastructure or services. This practice is underpinned by an assumption that untreated groundwater is typically suitable for drinking due to the relative microbiological safety of groundwater compared to surface water. However, chemistry risks are largely disregarded. Chemical contaminants occur widely in groundwaters that are used for drinking but are not regularly monitored. Example priority parameters are fluoride, arsenic, nitrate, or salinity. Sanitation systems are grouped into several types. The ladder of sanitation services includes, from lowest to highest, open defecation, unimproved, limited, basic, safely managed. A distinction is made between sanitation facilities that are shared between two or more households, a limited service, and those that are not shared, a basic service. The definition of improved sanitation facilities is, those facilities designed to hygienically separate excreta from human contact. With regards to toilets, Improved sanitation includes the following kind of toilets: flush toilet, connection to a piped sewer system, connection to a septic system, flush or pour flush to a pit latrine with slab, ventilated improved pit latrine, composting toilet. Access to sanitation services is included in Target 6.2 of Sustainable Development Goal 6, which is, by 2030, achieve access to adequate and equitable sanitation and hygiene for all and end open defecation, paying special attention to the needs of women and girls and those in vulnerable situations. This target has one indicator. Indicator 6.2.1 is the proportion of population using a. safely managed sanitation services and b. a hand washing facility with soap and water. In 2017, 4.5 billion people did not have toilets at home that can safely manage waste despite improvements in access to sanitation over the past decades. Approximately 600 million people share a toilet or latrine with other households, and 892 million people practice open defecation. There are many barriers that make it difficult to achieve sanitation for all. These include social, institutional, technical, and environmental challenges. Therefore, the problem of providing access to sanitation services cannot be solved by focusing on technology alone. Instead, it requires an integrated perspective that includes planning, using economic opportunities, e.g. from reuse of excreta, and behavior change interventions. Sanitation services would not be complete without safe fecal sludge management, FSM, which is the storage, collection, transport, treatment, and safe end use or disposal of fecal sludge. Fecal sludge is defined very broadly as what accumulates in on-site sanitation systems, e.g. pit latrines, septic tanks, and container-based solutions, and specifically is not transported through a sewer. Sanitation workers are the people needed for cleaning, maintaining, operating, or emptying a sanitation technology at any step of the sanitation chain. Hygiene is a broad concept. Hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. Hygiene can comprise many behaviors, including hand washing, menstrual hygiene, and food hygiene. In the context of WASH, hand washing with soap and water is regarded as a top priority in all settings, and has been chosen as an indicator for national and global monitoring of hygiene access. Basic hygiene facilities are those where people have a hand washing facility with soap and water available on their premises. Hand washing facilities can consist of a sink with tap water, buckets with taps, tippy taps, and portable basins. In the context of SDG 6, hygiene is included in the indicator for Target 6.2, proportion of population using b. a hand washing facility with soap and water. In 2017, the global situation was reported as follows: only 1 in 4 people in low-income countries had hand-washing facilities with soap and water at home, only 14% of people in sub-Saharan Africa have hand-washing facilities. Worldwide, at least 500 million women and girls lack adequate, safe, and private facilities for managing menstrual hygiene. Approximately 40% of the world's population live without basic hand-washing facilities with soap and water at home. The purposes of providing access to wash services include achieving public health gains, improving human dignity in the case of sanitation, implementing the human right to water and sanitation, reducing the burden of collecting drinking water for women, reducing risks of violence against women, improving education and health outcomes at schools and health facilities, and reducing water pollution. Access to wash services is also an important component of achieving water security. Improving access to wash services can improve health, life expectancy, student learning, gender equality, and other important issues of international development. It can also assist with poverty reduction and socio-economic development. Categories of health impacts. Health impacts resulting from a lack of safe sanitation systems fall into 3 categories. 1. Direct impact, infections. The direct impacts include fecal, oral infections, through the fecal, oral route, helminth infections, and insect vector diseases. See also waterborne diseases, which can contaminate drinking water. For example, lack of clean water and proper sanitation can result in feces-contaminated drinking water and cause life-threatening diarrhea for infants. 2. Sequelae, conditions caused by preceding infection. Conditions caused by preceding infection include stunting or growth faltering, consequences of stunting, obstructed labor, low birth weight, impaired cognitive function, pneumonia, related to repeated diarrhea in undernourished children, anemia, related to hookworm infections. 3. Broader well-being, anxiety, sexual assault, and related consequences, adverse birth outcomes as well as long-term problems such as school absence, poverty, decreased economic productivity, antimicrobial resistance. The WHO has investigated which proportion of death and disease worldwide can be attributed to insufficient wash services. In their analysis they focus on the following 4 health outcomes: diarrhea, acute respiratory infections, undernutrition, and soil-transmitted helminthiasis, STHs. These health outcomes are also included as an indicator for achieving Sustainable Development Goal 3, Good Health and Well-Being Indicator 3.9.2 reports on the mortality rate attributed to unsafe water, sanitation, and lack of hygiene. In 2023, WHO summarized the available data with the following key findings. In 2019, use of safe wash services could have prevented the loss of at least 1.4 million lives and 74 million disability-adjusted life years, Dallas, from 4 health outcomes. This represents 2.5% of all deaths and 2.9% of all Dallas globally. Of the 4 health outcomes studied, it was diarrheal disease that had the most striking correlation, namely the highest number of attributable burden of disease. Over 1 million deaths and 55 million Dallas from diarrheal diseases was linked with lack of wash. Of these deaths, 564,000 deaths were linked to unsafe sanitation in particular. Acute respiratory infections was the second largest cause of wash attributable burden of disease in 2019, followed by undernutrition and soil-transmitted helminthiasis. The latter does not lead to such high death numbers, in comparison, but is fully connected to unsafe wash. Its population attributable fraction is estimated to be 100%. The connection between lack of wash and burden of disease is primarily one of poverty and poor access in developing countries. The wash attributable mortality rates were 42, 30, 4.4, and 3.7 deaths per 100,000 population in low income, lower middle income, upper middle income and high income countries, respectively. The regions most affected are in the WHO Africa and Southeast Asia regions. Here, between 66 and 76% of the diarrheal disease burden could be prevented if access to safe wash services was provided. Most of the diseases resulting from lack of sanitation have a direct relation to poverty. For example, open defecation, which is the most extreme form of lack of sanitation, is a major factor in causing various diseases, most notably diarrhea and intestinal worm infections. An earlier report by World Health Organization which analyzed data up to 2016 had found higher values. The wash attributable disease burden amounts to 3.3% of global deaths and 4.6% of global Dallas. Among children under 5 years, wash attributable deaths represent 13% of deaths and 12% of Dallas. Worldwide, 1.9 million deaths and 123 million Dallas could have been prevented in 2016 with adequate wash. An even earlier study from 2002 had estimated even higher values, namely that up to 5 million people die each year from preventable waterborne diseases. These changes in the estimates of death and disease can partly be explained by the progress that has been achieved in some countries in improving access to wash. For example, several large Asian countries, China, India, Indonesia, have managed to increase the safely managed sanitation services in their country from the year 2015 to 2020 by more than 10 percentage points. Since 1990, the Joint Monitoring Program for Water Supply and Sanitation, JMP, of WHO and UNICEF has regularly produced estimates of global wash progress. The JMP was already responsible for monitoring the UN's Millennium Development Goal, MDG, Target 7.c, which aimed to have, by 2015, the proportion of the population without sustainable access to safe drinking water and basic sanitation. This has been replaced in 2015 by the Sustainable Development Goal 6, SDG 6, which is to ensure availability and sustainable management of water and sanitation for all by 2030. To establish a reference point from which progress toward achieving the SDGs could be monitored, the JMP produced Progress on Drinking Water, Sanitation, and Hygiene, 2017 Update and SDG Baselines. Expanding WASH coverage and monitoring in non-household settings such as schools, healthcare facilities, and workplaces, is included in Sustainable Development Goal 6. WaterAid International is a non-governmental organization, NGO, that works on improving the availability of safe drinking water in some of the world's poorest countries. Sanitation and Water for All is a partnership that brings together national governments, donors, UN agencies, NGOs and other development partners. They work to improve sustainable access to sanitation and water supply. In 2014, 77 countries had already met the MDG sanitation target, 29 were on track and 79 were not on track. Important awards for individuals or organizations working on WASH include, for example, the Stockholm Water Prize since 1991 and the Sarfati Sanitation Awards since 2013, for sanitation entrepreneurship. UNICEF's declared strategy is to achieve universal and equitable access to safe and affordable drinking water for all. UNICEF includes WASH initiatives in their work with schools in over 30 countries. On Water, an interagency mechanism which coordinates the efforts of UN entities and international organizations working on water and sanitation issues. The United Nations International Year of Sanitation in 2008 helped to increase attention for funding of sanitation in WASH programs of many donors. For example, the Bill and Melinda Gates Foundation has increased their funding for sanitation projects since 2009, with a strong focus on reuse of excreta. Awareness raising for the importance of WASH takes place through several United Nations International Observance Days, namely World Water Day, Menstrual Hygiene Day, World Toilet Day and Global Hand Washing Day. Thank you for watching this video.